I see individual patients who have body image issues and then eating disorders, I guess, is the more severe form of that. And then we have a group for people with eating disorders at the counseling center, which is really kind of a supportive group. So people come in each week and talk about their issues. And we have kind of different topics that we talk about with them in relation to body image and different exercises for them to do to kind of, explore how their eating disorder works. And very early on, they start setting goals around kind of normalizing eating and helping them get in touch kind of with their healthy voices. Kind of the way they talk about it in the group is this idea that, that your eating disorder is really self-destructive, and that at least during the course of the group, like dieting is not an option. It's really about normalizing eating and getting out of this mindset of the eating disorder of either starving yourself or harming your body in some other way. So people will set goals around kind of taking apart these rules they've made for themselves is oftentimes how it looks. So sometimes there's rules about I can only eat these certain foods, or I can't eat any carbohydrates at all, and I need to exercise 3 hours a day, and starting to kind of take apart some of these rules and bring eating back to kind of normal, and letting go of some of the control of kind of the eating disorder is really kind of the first step to help people. It's a similar process that I just described with anxiety, in that it's helping people step out of this idea of I need to look this certain way in order to be okay, and I need to, not eat these things in order to be okay, or engage in these, other behaviors. So yeah, the group, and there's a huge element of all the groups really that's about seeing other people who have similar issues that you do, and recognizing that you're not the only person on campus with an eating disorder or with depression, and that there's other people who get through it and who have meaningful lives and relationships, and even sometimes people who have come out the other side and are feeling better to varying degrees. And I think that's really kind of inspiring and helpful, and just having people who you're going through it with, I think, helps a lot.